Hi, I'm Dr. Tracy, and I'm here with our technician Ashley, and of course you know Rodney, you've met him before. Rodney is my geriatric dog that has a host of problems, and we're not going to talk about all of them today, but we are going to walk you through doing a fine needle aspirate on a lump. Rodney has a new lump. Wait, I got to do some explaining first. Let me back up. Rodney's got some green color on his legs and his mouth because he just ate an Oravet chew, and I swear we're not sponsored. Like, I just gave him this because he has anxiety here and I wanted to keep him happy, and he smeared it all over himself. He doesn't have a lot of teeth left. That's the same color. If you've not tried Oravet chews, they're pretty cool. There's some neat technology in here that acts like mouthwash and helps keep their teeth clean. You can get them on our online store. Follow the link on our website. So, I should also mention, Rodney has two medications in his system that we gave him this morning, gabapentin and trazodone. He's got anxiety when he's here. He pants, he barks and whines. He's nervous, like there's sick animals and strangers here. So he got a little medication orally this morning to ease his anxiety and make this visit more pleasant for him. If you've got a pet that has anxiety coming to the vet clinic and you are an established client of ours, call ahead, let us know, and we'll prescribe something for you to pick up that you can give your pet before their visit. That will just make things run smoother. So back to lumps and bumps. So I'm just gonna, now don't judge me. Rodney has a health condition that makes him fat. This isn't all fat, it's actually a big liver. So the lump that I'm concerned about is right here. I don't know if you can see, I can kind of grab it. So sometimes we'll use a caliper to measure these, but honestly, I'm going to estimate that, you know, at probably 3 by 4 centimeters. And I can pull it away from the body. It's soft. He does not seem painful. So I want to make sure that this lump is not something that is going to spread to lungs and lymph nodes. It's not a cancer that I need to do aggressive treatment on. So the first step in finding those answers is doing a fine needle aspirate. So we're going to use a little bit of disinfectant to just quickly scrub that. We don't want to actually introduce any bacteria into his lump. So we just take a little extra precaution. It's not necessary to clip. We don't need to wear sterile gloves, but we do just take some minor precautions. Rodney is not needle shy. He doesn't mind needles, but if you had a pet that didn't like needles, this is something we could sedate them for. Of course, sedation requires a needle too sometime. So I'm going to go ahead and take a sample here. Basically, I'm redirecting this needle in a couple different directions. I'm not going through the skin, I'm just redirecting, and the sample is actually sitting in the metal part of the hub. I'm going to grab a microscope slide and I'm going to spray those on, and sometimes we spread it around, sometimes we don't. I don't know if you can appreciate what's on there. So now I've done a couple of these in my career, so based on what I feel, based on the location, and based on what I see on the slide, I have a hunch that this is going to be a lipoma. Now, a lipoma is the single most common lump that we see. In fact, we have dogs that come in, usually older dogs, that literally will have like 30 lipomas. Like, their lumps will have lumps. So a lipoma is a fatty cyst, and they are actually benign, and they're relatively harmless unless they're in a bad location. So if we had a lipoma, oh my goodness, Rodney's got another lump. We got a skin tag in our armpit. But if he had a big lipoma in his armpit or in his groin or by his rectum, maybe in his thoracic inlet, some place that would interfere with range of motion and possibly push like his elbow out, we may be more aggressive to remove those. But right here, this lipoma isn't a place that's going to hurt Rodney. So if I confirm under the microscope that this is a lipoma, then I don't need to worry. It could probably double in size and still not bother him, and it's not anything that's going to spread. So why don't you come with me to the microscope? Okay, so we're over in our lab, and what I've done is I have stained this slide, and I'm going to look at it under the microscope. We use special stains, and as you can see by our array of slides, we do a lot of cytologies. And when we find something unique or when we find like an actual cancer, a lot of times we save them because we can use them as a reference for the next dog that has that lump. So I'm just going to take a quick look under the microscope and see what I see. And so far, so good.
Hey, Rodney.
Guess what, Rodney? No cancer, just a lipoma. So this is good news. I feel a lot of relief. I'm sure my family will too, that Rodney's lump is not cancer. It's not another problem we need to add to his list of many problems, and he's going to be just fine.